Good morning, my name is Latasha Jones. I'm a student with the College of Central Florida, and I'm getting ready to complete a trach suction skill. Before I enter the patient's room, I verify the physician's orders, and I'm getting ready to go in. The supplies are in the patient's room on the bedside table, so you can come with me. Before I enter the room, I will knock on the patient's door. Knock, knock.
Come in.
I'll close the curtain to provide for privacy. I will get some sanitizer and foam in before I touch the patient and wash in. Good morning. My name is Latasha. I'm a student with the College of Central Florida, and your doctor has ordered this morning for me to go ahead and suction your trach because you got a couple of crackles. Because patients that are normally on trachs, they really can't talk too much, I will compare the patient's armband and date of birth with the physician's orders, and they match. Are you Grace Jones, date of birth 1/3/1967?
Yes.
The patient shook her head up and down, so that will just be my third check that this is the right patient. So, before I get started, I will make sure that the suction is working since I'm on this side of the room. I'll go ahead and turn my suction on, and I will turn it on low intermediate, which is between 80 and 120, and I hear it's working just fine. The connection is already on this side of the patient, which is the side that I prefer to work on. So I will just go over there. Go ahead and get the bed all set up before I open up my supplies. Lift the patient's bed up. Go ahead and fold my hands again. Now I do have the Ambu bag, which provides 100% oxygen that I'm going to pre-oxygenate the patient with. The suction is running. Now, Mrs. Jones, but when I begin suctioning you, if you feel like I need to stop, I want you to raise any hand. Just push it up, flash it up, and I'll stop, okay, and give you a little bit of rest. So I've established my distress signal with the patient. I'm going to go ahead and get started. Put this down. Now, this is the patient's airway that's going to be there. Now, because I'm going to be suctioning the patient, I'm going to have my PPE. For the purpose of the video, I will not have the PPE on. And before I suction the patient, I have already completed a respiratory assessment. I've checked the lungs, front and back, and I've heard crackles and a few wheezes. And I've also checked the patient's respiratory rate. I've looked for cyanosis, and it's all been completed, and I will also complete it afterwards. So everything is prepared. I'm going to get ready to start. Now, I'm going to go ahead and remove this pillow, Mrs. Jones, okay? Just so I can get your head up a little. Is that okay? All righty. Okay. So I'm going to go ahead and take the chucks and place it over the patient so that she's protected. Now the suctioning is working. I'll just take my finger and just make sure that it's still working before I connect it. Now I do have my normal saline here. This saline, it's not expired. It expires March 2017. It's clear. It's brand new, so I can go ahead and use it. Once I open the saline, I will date, time, and initial it, and it will only be good for 24 hours. Again, I would put on my PPE, which consists of a gown and a mask with a face shield, but for the purpose of the video, I will not have it on today. I'm going to go ahead and get my supplies. Wash my hands again. I bought an extra pair of sterile gloves just in case I need them. I'm going to go ahead and open up my kit sterilely. I'm going to open up my saline, palm it, and I'll lip it. Take the cup out. Now the inside is sterile. I've only touched the outside, which is the cardboard part. Go ahead and pour my saline in the inside of it. And I will probably bring this close over here. Open up my supplies. I get a 1-inch border, so I'm just gonna make sure that this stays my 1-inch border. Turn it around here. And I have that 1-inch border, and I'm gonna go ahead and don my sterile gloves. Sterile can touch sterile. I'm going to go ahead and pre-oxygenate the patient before I get started. So with my non-dominant hand. And I'll give 6 pumps. 1, 2, 3, 4, 5, 6. Take this and connect my catheter. Just leave that there, making sure that it stays sterile. Now I'm just going to go ahead and test the suction. Applying the suction, it is working. So I'll go ahead and insert. I'm going to remove this, the air supply. Okay, Mrs. Jones, I'm getting ready to go in. Remember to raise your hand once if you need me to stop. On the count of 3, 1, 2, 3, going in, making sure that I'm not touching the suction as I'm going in. And I'll just keep inserting until I meet resistance or I hear the patient cough. I feel resistance. Now I'm going to go ahead and suction using the twisting method. And I'm suctioning. Go ahead and clear that out. Apply the oxygen again. Give her a little, some time in between the second suction, and I do hear some more coughing, and I'll do it a second time. I will wait 1 minute, 1 full minute before I do the second suction. How are you doing, Miss Jones? You're doing pretty good, okay? So at the second pass, 1 minute has passed. And before I do that, I'll go ahead and pre-oxygenate her 1 more time for the second time. I'll remove that, apply the amber bag, give 6 pumps. 1, 2, 3, 4, 5, 6. Now I'm going to go ahead and suction. Okay, Ms. Jones, I'm going in again, being sure not to put my hand up against the suction as I'm going in. I'm going to go ahead and keep going in until I feel resistance, which I do. Once I feel resistance, I will withdraw 1 centimeter. Gonna go there, and now I'm gonna apply the suction using the twisting method. Making sure that I'm maintaining sterility. Suction for approximately 10 to 15 second intervals. It's complete. Go ahead and clear the line. Put the patient's airway back over. Now, I don't hear any more crackles. After I completed my second assessment, after this is over, then I know that it's done once the patient's airway is clear, if I don't hear any more crackles or coughing, and I don't see that. So now I'll go ahead and discharge this. Clean up everything. After the second respiratory assessment, once I complete it, I'll listen to the anterior and posterior lung fills, assess the client's capillary refills, pulse ox, and count the respirations, and she looks like she's doing good. I'll put the pillow back, put the side rails up, put the bed down. Ms. Jones, is it okay if I leave you up for a little bit? She shook her head yes. I'll just go ahead and put you back just a little bit, but not too far back, just to make it more comfortable for you. Your call light is right here. It's on your left side. Can I get you anything else before I leave out? I'll throw all of my supplies in the trash, but before I leave the room, I want to make sure that I turn the suction equipment off, which I did. Call light is in reach, bed is down. For the purposes of the video, I'll just keep it here, but normally I would discard everything and leave the saline at the patient's bedside. I will wash my hands before I leave out. Okay, Ms. Jones, I'll be back to check on you in about 30 minutes or so, okay? I will open the curtains if she so chooses and be sure to document my assessment and my procedure.